I'm Dr. David Goldberg. I am the Director of Clinical Research and Cosmetic Dermatology for the Schweiger Dermatology Group. We are somewhat less than 200 offices from coast to coast, Midwest, Eastern Seaboard, Florida. I also run two fellowship programs in cosmetic dermatology through the American Society for Dermatologic Surgery. I practice cosmetic dermatology. We've done a lot of research in the area of hair, going all the way back to the 1980s and 90s with topical minoxidil. We've done some of the studies on platelet-rich plasma for hair. We've done some of the studies on low-level light. We're currently involved in a trial for oral minoxidil through the FDA. I run meetings. Just ran a meeting this past weekend called New Frontiers in Cosmetic Medicine, where we talked about the current prolactin studies, and we do a lot of research as well. So the current standard of care for androgenetic alopecia, frankly, is not very high. As I mentioned, I was involved in the topical minoxidil studies. That's known as Rogaine now. Everybody comes in on that. That's not a prescription. The numbers of people seeking treatment for hair thinning are staggering. If you look at men, it's by the time they're 35, people are complaining. Women, by the time they're 40, women actually by the time they're 65, 80% of them complain of hair loss. And yet, what do we do for them? We have them on topical minoxidil. That doesn't do a lot. We start talking about platelet-rich plasma and low-level light. In order to do that, they have to have their arms drawn blood. That's painful. It can lead to black and blue. We then take that blood, we spin it down in a centrifuge, and then we re-inject it into their scalps. That's a painful procedure. They have to come into the office. It's done once a month. And although we do a series of usually 4 or 5 treatments, it really is in perpetuity, so they're constantly coming in. On some of the men and some of the women, we give them what's called oral minoxidil now. It's not even FDA approved for hair loss. It's FDA approved for blood pressure. The dosages are really made for blood pressure. They're not made for hair thinning. Some people have problems with dizziness, dropping of blood pressure. Some of the men, we give oral finasteride. That blocks testosterone, the hormone that leads to hair thinning, both in men and women. And the problem with that in men is some of them get erectile dysfunction. There's so much talk now on social media about suicidal thought patterns in men who are taking that drug. You get a sense that the treatment approach right now is just not optimal. And we currently don't have an ideal treatment for hair thinning. I mean, that's just pretty obvious. If you look at surveys out there, less than 10% of people are happy with the current treatments we have. And so what we want in a new hair treatment for hair thinning and hair loss is something that is convenient, doesn't have to be done that often, and it's got to be durable. Durable means, they don't have to necessarily have an injection every week. They don't have to come into the office every month. Something that ideally they could do at home, maybe they'll start every week, but ultimately maybe every 2 months, every 3 months, something along that line. And we now are on the cusp of a drug that potentially can do that. And, this is such an exciting arena right now that I'm going to be discussing this at the end of January at a meeting called IMCAS Paris. It's the largest cosmetic dermatology plastic surgery meeting in the world. There are some 20,000 people there. They all want to learn about this new product, this new approach, this prolactin receptor inhibition. It's a very exciting area. So ABS-201 clearly is a game changer. One, it's a totally new mechanism. The fact that these hair follicles have these receptors, and then ABS-201 now can block those receptors and convert resting, non-growing, non-pigmented hairs into thick, terminal, growing, darkened hairs is revolutionary. So as I mentioned before, we currently are involved in FDA studies for longer lasting minoxidil products, allowing the higher dosage to be given, hopefully safer than is what currently available on the market. But in the end, that doesn't work the way ABS-201 works. The way minoxidil works is it dilates blood vessels in the area of the hair. It gives them more nutrition, but it's not a direct impact on the hair. That's number one. Number two, that's going to require compliance. People have to take pills twice a day. What's exciting about ABS-201 is how often people are going to need the drug. We're looking initially at maybe 2 to 3 injections over the first 6 months. But think about it this way. Growing hairs, they're called anagen hairs, they last for a couple of years. And so if we get those injections, 2 to 3 over 6 months, and then we're back in that growing hair stage, people are not going to need to do injections very often at all. With the excitement behind ABS-201, I cannot help but think about my own personal practice and where I am with Schweiger Dermatology. As I mentioned, we're talking about slightly under 200 practices coast to coast. We're the second largest dermatology group in the country. We have over 2 million patient visits every year. Roughly 10% of people come in for hair thinning. I can only imagine the commercial market we're going to have once ABS-201 comes onto the market. So we recognize what role ABS-201 can play in our huge dermatology practice. But it'd be nice to now hear something about the commercial development of this product. And with that, I'll pass it on to Mike and Zach.